So in this video, we're gonna be doing sacroiliac joint mobilizations, and we're gonna do both sides, both directions. So for the first mobilization, you're gonna have your left leg in front of your right leg and kind of square your hips to the front of the room or in front of you. And then you're going to lean forward so that your pelvis is coming forward. Your shoulder is going to stay about right over your knee. And then you'll bring your pelvis back. So pelvis forward, pelvis back. We'll do 10 of those. Just nice and easy. We're trying to get to the end of the range of motion of your front of your hip and back of your pelvis. And then we'll try the other side. I'll face you so you can see it from a different angle. So pelvis is square, front knee is bent, and you're gonna drop your pelvis forward and then bring your pelvis back in line with your shoulder and your knee. And we'll do 10 of those. So this is an anterior mobilization of the left side of your sacroiliac joint. So we're doing anterior mobilizations on both sides first, and then we'll do a posterior mobilization. You don't want to have any pain. You might feel a little bit of a stretch. That's okay. Okay, and now we're gonna go the other direction. So the posterior mobilization starts in the same position. You're gonna have your knee, hip, and shoulder all in the same line, and the other knee right over the other ankle. Now for this one, we're gonna be bending forward. And if you can see me from the front, my shoulder and my knee are kind of in the same line. So if that's not available to you, that's okay. You can have like a little pillow or a couple books here to support you. And then what you're gonna do is bend your shoulders towards the floor. And so you're stretching the back side of the sacroiliac joint. So we'll do 10 of these as well. Now notice that my whole body is in like right angles. So I have a right angle here, 90-degree angle. I have a 90-degree angle here and a 90-degree angle here. We're gonna try to keep those angles. And I'm gonna do 10 of those, and then I'll flip forward so you can see the opposite side from this direction. Now, if this is unavailable to you, I also have these mobilizations in standing, so I'll send you both of those videos. So right now I'm just bending down, and you can tell, maybe you can tell from the video, but I'm not as flexible on this right side. So I don't go as far until I reach the end of my flexibility limits, and that's okay. And that's it. We've done both sides, anterior and posterior sacroiliac joint. Let's look at it in standing.